my opinion, for the betterment of the health of literally millions of Illinois citizens. The federal health care reform has been signed into law by the President, and it does provide an opportunity, $5 billion to the states of our country to provide a health insurance to many citizens who have no insurance or are paying extraordinarily high rates for that insurance. They're called a high-risk pool. These are men and women who have oftentimes pre-existing conditions, and in order to be insured in anything, they need to pay an extraordinarily high premium. Our state has had a law for some time called I-CHIP that provides health insurance on this basis, but it's very oftentimes unaffordable to working families because of the very high premium. Under the federal health care reform, the premiums have been reduced to affordable levels for those with pre-existing conditions, and the federal government is providing to our state $200 million from the federal government to help finance this. And we have to quickly pass a law that makes our state eligible for this federal money for a high-risk insurance pool that complies with all the federal requirements and does make health insurance affordable for literally thousands of Illinois citizens, particularly those who are afflicted with pre-existing conditions and who have been treated by insurance companies in a way that's oftentimes very difficult for that family. That's number one. Number two, we believe in a health care insurance Bill of Rights, and I want to spell out some of those items in it. Guaranteeing coverage for children with pre-existing conditions, making sure that the state has a review process when a health insurance company cancels coverage on someone. Right now, if you have home insurance or auto insurance, you have an ability to appeal to the Department of Insurance to make sure that you're getting a fair shake. That provision does not apply right now to health insurance, and it should, and we want to include it. Unfortunately, our state has had problems with what are called rescissions in the law of insurance, where someone who has insurance, they think, is told by their insurance company at the time they most need the insurance that you don't have the insurance. This is called a rescission process. I think I've been told that Illinois has 50% more rescissions of insurance coverage of people who thought they had it for their health than in the state of California, which is about 3 times bigger than Illinois, at least 2.5 times bigger. So we have more insurance rescissions in California. So this is an area that we need to really look into. We don't want people who are most needing health insurance at the moment of need being told they don't have coverage by their health insurance company. We also want to guarantee the access of women to obstetrical and gynecological care. That's what this law does. It also gives parents the right to keep their children on the parents' health insurance policy until the age of 26. Many young adults do not have health insurance. They're the largest group of uninsured citizens in our country and our state, and this would allow for their parents to cover them, and they would be able to be covered until the age of 26. It would also require insurance companies to cover preventive medicine, such as immunizations, and at no cost to the policy holder. This is another reform that's needed. It's much more cost effective to pay for a vaccination than to pay for hospitalization for a preventable illness. Finally, we want health insurance companies to publicly disclose information about their premiums and their expenditures, their enrollment and claims information. We need to know the facts. And so these are fundamental health care insurance reforms that we need to make sure are covered in Illinois by our Department of Insurance. When I became governor a little more than a year ago, I ordered that the Department of Insurance be its own separate department. It had been folded into the department with a bunch of other agencies, and I just didn't think that was right. Insurance is so important to all the families of Illinois, whether it's your car insurance, your home insurance, and health insurance. These are very, very important matters to every family. And we've got to make sure that we have health insurance reform for consumers. And I really believe in this. I think this is something that is necessary. I talked to the President of the United States about it when he was in Quincy last week. I said that our state of Illinois, I thought, should pass both of these reforms that are contained in this particular bill. It's a healthcare insurance consumer bill of rights, and it's also establishing the proper framework for a high-risk insurance pool that will make us eligible for $200 million of federal money to provide health insurance to people who most need it in the state of Illinois. So without further ado, I'd like to ask our excellent Department of Insurance Director, Mike McCraith, who's been in the vineyard here working and fighting for consumers ever since I've known him. And he's out there right now this week. It's very important this week that we get these fundamental reforms in health insurance for consumers adopted by the legislature. And so, Mike, we're going to ask you to kind of take it from there, a little bit about the further details of what I mentioned.
Great, thank you, Governor. And I will also want to thank the Governor for reestablishing the Department of Insurance and further facilitating and supporting our effort to protect consumers around the state, the families and businesses who purchase insurance. When the Governor entered that order, his instructions to me were to be professional and responsible as the regulator, and that's what we endeavor to do at the department every day. Today, to help understand the reasons for the proposed legislation, we need to understand the state of our marketplace right now and make no mistake that Illinois' health insurance marketplace right now is completely dysfunctional. It is dysfunctional and anti-family. It is dysfunctional and anti-business. Some of the signs of this are becoming more evident every week. Families in Illinois can be denied insurance for any reason other than race, color, religion, or national origin. And for that reason, a family was denied health insurance by one company because the mother attended grief counseling after her husband died. As the Governor mentioned, and he stole my thunder as he can, the state of Illinois by volume has more rescissions than any other state in the country. 50% more than even California. On a per capita basis, we're second only to the state of New Mexico. One company, in fact the same company that denied coverage to the family, attempted to rescind a teenager's policy because her parents didn't disclose on the application that she had braces, orthodontal braces. In Illinois, we're seeing explosive health insurance rate increases. We've heard the story about WellPoint in California, 39% increase. The president brought attention to this increase. And it's relevant, not just because it drew national attention, but because the California regulators had the authority to review the rate and determine whether that rate was fair, whether it was appropriate. The regulators had the ability to make decisions in the interest of consumers, recognizing the financial needs of the company. And in fact, when the regulator conducted that review, it found that WellPoint had made a mistake, that WellPoint's actuaries were wrong. And the department in California has required a reduction in that proposed increase. At least 30 states have prior approval by the regulator, the insurance regulator, of premium increases. In Illinois, for families lucky enough to have coverage, they are being priced out right now. As the insurance department, all we receive for family coverage is a list of increases annually. We have no ability to approve or deny those. For small businesses and large businesses, we don't even have that authority. We have no idea what small groups are charged, small business owners are charged every year, and how much their premiums increase year to year. In fact, Illinois law does not even require that the insurance companies have actuarial justification for their rate increases. Small groups, small businesses are seeing 50% increases or more. High deductible plans, theoretically more affordable, premiums are increasing by 30% or more. So I want to thank Governor Quinn and his support for the Health Insurance Consumer Bill of Rights. Working with our state colleagues, state regulatory colleagues from around the country, and with the Department of Health and Human Services, we will implement reforms consistent with the Governor's direction. And this Bill of Rights will support that implementation and help assure that our families and businesses have the protections they deserve. In terms of the high-risk pool, we look forward to implementing that expansion. It is not a silver bullet, it is not a panacea, but it will provide great relief to families around our state in this important transition period leading up to 2014. The iChip program will be ready to receive the funds and implement and operate the program in a fiscally prudent manner, ultimately trying to provide the best health care for as many of our residents as possible, residents who have been denied by the health insurance industry in our state. Thank you very much.
Okay, well said there, Mike. I really am impressed by Mike's tenacity and fairness. He's a consumer advocate from beginning to end, and that's what we need in the Department of Insurance. We want to make sure that everybody gets a fair shake when it comes to health insurance. I walked across our state in 2001 on behalf of decent health care for everybody, and part of decent health care is having decent health insurance with standards and rules that are fair, and if there are any violations, there's a regulator nearby at the state of Illinois level to straighten it out and correct it. And during that walk, I had a chance to visit with Jim Duffett, who's our next speaker. He's with the Campaign for Better Health Care. And Jim, why don't you take it from there?
Thank you. Good afternoon. My name is Jim Duffett. I'm the Executive Director of the Illinois Campaign for Better Health Care. CBHC is the largest healthcare grassroots advocacy organization in Illinois. Recently, our federal elected officials, under the leadership of President Obama, enacted by passing historic healthcare reform legislation in March. Illinois is fortunate to have the leadership of Governor Quinn and Director McGrath in making sure that these federal reforms are enacted decisively and strengthened for Illinois businesses and consumers. The enacted federal legislation is a benchmark, and states do have the power to enact consumer protections sooner and, if need be, to make them even stronger. The Consumer Bill of Rights announced today by Governor Quinn must be passed by the Illinois General Assembly before they adjourn. Too many months will go by and too many Illinoisans' lives will be shattered if action does not occur. The role of government is to help society, not to hinder it, and not to protect the special interests. The Campaign for Better Healthcare also runs a helpline and a story bank where we help thousands of people throughout the state not only get access to health insurance, but to also take their stories. And we use those stories to help formulate common sense solutions to their problems. And this is exactly what this bill is. I'd like to briefly touch on one story. This was 2009. This is when a 17-year-old, Brianna Rice, was diagnosed with celiac disease in February, and she did have health insurance. What she didn't know was in the months that followed her diagnosis, her insurance company, American Community Mutual Insurance, combed through her medical records and ruled that her parents lied on the application last year. In May, American Community not only canceled her policy, but also rescinded the coverage all the way back to the day that it first started, November 1st. Her parents, needless to say, Dave and Pat of Deerfield, Illinois, insisted they were truthful on Brianna's application and said that the insurance company is trying to back out of covering their daughter because of the February diagnosis. Needless to say, both her parents are livid, and when a private insurer gets legitimate claims and seeks to find excuses not to pay them, they are clearly demonstrating morally and ethically bankrupt behavior. That's from David Rice. The family situation shows just how quickly health insurance problems can lead to financial ruin. With their daughter's unpaid medical bills, again, this is an article that a story appeared last year. At that time, their bills were exceeding over $20,000 in mounting, and the Rices were fearful that they would have to foreclose on their home. I want to thank the governor for this initiative and Director McGrath, and we hope we can thank the General Assembly at the end of this year for moving forward and passing these reforms. Thank you.
Well said there, Jim. Thank you very much. And this is an issue obviously affecting lots of people of modest income or low income in Illinois. Everybody's in, nobody's left out when it comes to the right to have health insurance. This is not a privilege that's sort of allocated out based on a wallet biopsy. It should be based on the fact that you need health insurance and everyone's entitled to it. So we have Margaret Stapleton here from the Sargent Shriver National Center on Poverty Law. Margaret, why don't you take it from there? Okay.
Thank you, Governor. Thank you, Governor Quinn, Director McCraith, and Jim. I'm Margaret Stapleton. I'm a senior attorney at the Sargent Shriver National Center on Poverty Law. As Governor Quinn alluded, we work on behalf of low and moderate income people, not only in Illinois, but throughout the country. And we're here today to support these initiatives from Governor Quinn. We were delighted when the federal health reform bill passed. The Shriver Center had worked for decades, actually, for many of the kinds of reforms that were brought into law by the two bills passed by Congress and signed by by President Obama. And we are delighted to see them being rolled out in Illinois and nationwide. Those bills put the whole country on track to the goal of everyone, I believe, which is affordable, quality health care for all. As I said, we worked for decades for the kinds of reforms that we're beginning to see hit the road here in Illinois and elsewhere. And I'd just like to speak about two of the reforms that will be rolled out under the legislation that Illinois is hopefully going to enact, and not this year, but this week, I hope, but I'm not even sure about that schedule. One is this whole issue about people with pre-existing conditions. The federal health reform bill will deal with that incrementally. By 2014, we won't care anymore about pre-existing conditions. You will be able to be insured. But right now, there are people in Illinois and all over the country who are being denied coverage because of pre-existing conditions and what's been described as a federal infusion of funds to help moderate income people buy into the state high-risk pool or the pre-existing conditions pool is going to be immensely helpful to people in Illinois. Currently, Illinois has a high-risk pool, but the premiums are pretty high, and many people who can't get insurance, no insurance company will write an insurance policy for them, also cannot afford to get to the state's high-risk pool. So that's an immensely helpful piece of legislation in Illinois. And the other thing is really a very small but immense improvement, which is that insurance companies will need to pay for preventive care and testing. I can't tell you the number of people that I've talked to, people who are trying to do the right thing. So they think they should be insured, and so they buy a high deductible policy. They stretch their budget. I mean, they go without other things so that they'll be insured and they won't face the risk of losing their home or having to go bankrupt or losing any modest amount of savings they might have. And then they really can't afford to get it, health care. They pay their premiums every month, they have a high deductible, and they can't get the mammogram, they can't get the x-ray, they can't get anything that by way of recommended preventive care because they don't have any money to pay for it. So I really think that among the things that these two bills that are going to be moved in Illinois now will address for the immense betterment of people in Illinois are those two things. Thank you very much.
Okay. Thank you, Margaret. And thank you for your good work at the Sargent Shriver National Center on Poverty Law. We have one more speaker from the Illinois Maternal and Child Health Coalition. This is a group I've known for many years. I spoke at their annual lunch, I believe, last year. Kathy Chan is with us, and Kathy's going to talk about how important this is for mothers and children. And take it from there.
Thank you, Governor. My name is Kathy Chan. I work with the Illinois Maternal and Child Health Coalition. We're a statewide organization that's dedicated to improving the health and well-being of women, children, and their families through policy, advocacy, and also community empowerment. On behalf of Illinois' women and children, we applaud the leadership of both Governor Quinn, Director McCraith, and other state officials who affirm Illinois' commitment to implementing federal health reform. Too often, our organization has heard stories from families that are unable to get private insurance coverage for their child because of a pre-existing condition, oftentimes originating at birth. And most recently, we've been paying attention to the horrific news stories that have uncovered how women with breast cancer were targeted by WellPoint Insurance Company to have their policies canceled. This legislation starts the process for Illinois to really begin fixing our broken health insurance system. Many of the things that I'm going to mention were already mentioned, but just to reiterate, but this is done so by guaranteeing private insurance coverage for all children, regardless of their current or previous health history, guaranteeing women direct access to OBGYN care for their well women care, and also promoting wellness and prevention by eliminating co-pays for preventive visits and services. With the tough fight for health reform now behind us, it's important and critically important to focus on the full implementation of this law, as well as to inform all eligible persons about the changes that are effective now. We look forward to working with the governor and also with Director McRaith to get this done. Thank you.
All right. Thank you, Kathy. Thanks for being there. Okay, any questions on this? This is a bill that will come up. We're pushing for it this week. It's very important to get the $200 million that's allocated for our state. And then as long as we're working on health insurance, we wanted to pass this Bill of Rights that is embodied in federal law, but we want our state, the state of Illinois, the Department of Insurance of Illinois, to be the regulator, the enforcer. That's permitted under federal law, and we need our legislature to go along with that, so we have someone on the job all the time protecting consumers.